The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Hey folks, Dr. Joe Esposito here. So glad you could spend a little time with us today. I've been in practice 34 years, and I've seen a lot of changes happen in 34 years. And one thing that I've seen skyrocket is attention deficit disorder. People that have trouble focusing. And that's not just for kids, it's for adults as well. So it's called ADD, attention deficit disorder, or ADHD, attention deficit hyperactivity disorder. So ADD, kids can kind of like phase out and not be able to absorb information. Hyperactivity is the kids are just all over the place. Now what's neat is over the years, I've done a lot of research in this field because it's so prevalent, and we've come up with a lot of things that seem to work, and they work very well. And this is very exciting because for years we'd sit down with the kid and we try to have the conversations and don't do that. But now we're realizing that the child may not be able to control, or the adult, control themselves. It's out of their control, it's a brain thing. And so if we can fix the brain, many times people are able to function normally again. Wouldn't that be nice? And so a lot of research that I've done, a lot of research other doctors have done, we're going to talk about today. So pay attention because it's not just if you have obvious ADD and ADHD, or ADHD, it's how can we improve our memory? How can we improve our brain function? How can we improve our ability to focus? Our ability to pay attention to other people when they speak. Anybody do this? You're talking and all of a sudden you start phasing out? Anybody phase out yet from my show? I don't know. We've got to teach you how to get the brain working better. And the reason is not just because I want you to think better, it's actually going to help your body be healthier. Your brain controls everything. Again, I'm a chiropractor, first time you're tuning in. I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition, BS in nutrition, retired dietitian. And my job with my patients and my team of doctors, what we do is we try to get the body well. Not just out of pain, but well. Because pain is just a piece of the action. We can get you out of pain pretty quickly in most cases, but then we need to stabilize the body so it maintains that new level of health. So the brain controls everything. Your brain sends messages down your spine, out your nerves to every cell in the body. The heart, the lungs, the liver, the spleen, the digestive system. Everything is hardwired to the brain one way or another. And so we have to make sure the messages are getting there. So if we can get the brain to work more efficiently, not just on focus, it's able to do everything else better, which is kind of cool. So, ADD and ADHD. Almost all children that have this syndrome have a bad self-image of themselves. And the problem is, what happens is we make derogatory comments to them. You're a troublemaker, you're the class clown, you don't pay attention, you're a bad child. And that's not good because commands and questions like these are put downs and it makes the problem worse. It gives the child a bad self-image. And that could then result in a lot of psychiatric issues. So, one of the problems we have is that when a kid's acting up, you can't just say, oh, that's fine, Bobby, that's great, just keep doing it. But also, if you keep putting the kid down, he starts having these emotional feelings inside. I'm a failure, I'm not good enough. So we're going to talk about, instead of treating the symptom, which is the ADD and ADHD, how do we get to the cause? So that's going to be the topic today, which is pretty much the topic of every show I think I've ever done. Don't treat the symptom, treat the cause. So I find that children with ADD and ADHD have a lot of digestive disorders. And everyone I've ever met, and I've met thousands over my career, because a lot of people bring their kids to us and adults, are not getting the proper nutrition. So let's start with the parents. We're going to go right back before baby's even conceived. So if you're thinking about having babies, sometimes you don't know you're going to have a baby, sometimes it pops up on you. A couple of things I want you to consider. Women, folic acid. You have to make sure you're getting enough folic acid to make sure you prevent spinal and neural defects. So that's important. So as I go through this, I'm going to mention specific supplements, but then I'm going to give you the overall picture of it, okay? Men, you need zinc. Both men and women, fatty acids, magnesium, calcium, and B-complex. So these are things that we all need, no matter whether trying to conceive children or not, but especially if you're going to have a child. So if you have childbearing years, men and women, you never know when things are going to happen, make sure you're doing the right thing. Women should try to gain weight during pregnancy. I know it sounds silly. But some women are so hung up on their, I want to keep my figure, I don't want to gain a lot of weight. You got to gain weight. I find that a woman gains around 20, 30 pounds, the child is going to be less likely to have food allergies and usually less likely to have ADD and ADHD. So I don't want the woman starving herself when she's pregnant because it can have an adverse effect on the baby. Remember, That baby is living off you. Anything you put in your body, baby gets, good or bad. So if you're putting zinc, selenium, folate, B complex, magnesium, fatty acids, baby gets them, grows big and healthy and strong. If you're putting things like alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, guess what? The baby's trying to survive on that. And as a side note, that kills me when I see a pregnant woman doing that. And I know it's not my place. You know, there's a line from a 10,000 Maniacs song, and it says, he's your kid, do as you seem fit. But it drives me insane when I see these things happen, knowing that something as simple as taking some supplements, that something as simple as having a salad every day could so positively affect that person's life, not just the child, but the whole life of that child. And all the mother has to do is do some simple little things. And when I see it, it just hurts me. And then when babies are born, of course, when I see parents giving them a cookie, and I went to a party the other day, and there was a little kid there, and the one kid loves one of his grandmothers. Well, what is she doing? She's giving him cookies and cakes, and you're a little kid, of course you love that stuff. But you as an adult have a responsibility to make sure the child is taken care of. That's our job. Our job as parents or as adults is unconditional love. It's not the child's job. It's the parent's job to offer unconditional love. And so the child eventually will get to that point, but again, as a child, that's not their responsibility. It's our responsibility as adults. So part of that responsibility of showing unconditional love to a child is making sure the child is raised in a healthy, safe environment. And you're thinking, well, Dr. Joe, that might be a little insane. Giving a child a cookie is not an unsafe environment. Yeah, giving him a cookie is not a problem. Giving him cookies every day and cakes and donuts and ice cream, that becomes a problem. And now the child may not be able to focus. The brain's a sack of chemicals. Good chemicals in means the brain works better. Bad chemicals in, the brain doesn't work. Now the child becomes an issue, and the parent says, I don't know what I did wrong. Parenting is so hard. It must be something that I did, or maybe it's something outside that I had no control over. Yeah, you did. And that's why it's important that when a child's in a healthy environment, nutritionally I'm talking today, that the child grow up in that environment and they're able to function better. For women, when they're pregnant, I strongly advise they stay away from hyperallergenic foods, things like dairy products. That's milk, butter, cheese, yogurt, ice cream, eggs. Milk is the #1 food allergen, or milk products. Wheat is the #2 food allergen. Now, some people say it's a little hard to give up wheat. You're right, it is. But if I have an investment, I want to work on that investment to make sure I get the best rate of return. Same thing with a child. A little bit of work is going to give you a very good rate of return. So wheat would be a good thing to give up because those hyperallergenic foods can get into the baby. Their immune system is not developed like yours is. This is why children get sick. You ever notice babies, they're always sick, children are always sick? Because their immune system is learning how to fight off viruses, germs, and bacteria. A couple of weeks ago, I did a show on cold and flu. And if you go to my website, drjoe.com, we have well over 1,000 hours of podcasts there. If you have a podcast service, it's called For the Health of It, and you can tune in and go through the list of shows and listen to the one on cold and flu. And we talk about that with children because you and I as adults, our immune system has learned. Okay, virus A, we've been introduced to it, our immune system knows how to fight it. Virus B comes in, virus C, virus D. Babies don't have that. They don't have a background, they don't have a history. And so they have to learn each time a virus comes in how to fight it, or a bacteria or a fungus. And so their immune system is still learning, that's why they're sick all the time. So if you can avoid a lot of these hyperallergenic foods, you're going to take the stress off the baby's immune system, and you got a better shot of this baby being healthy. So women, I know you're thinking that's tough. I got to give up milk and dairy products? Yeah, you should. At least cut back on it. But please give it up if you can. And the cool part is this. I've been a vegan now for 33 years, I guess now. And when I first started, it was salad, rice, and beans. Man, that was it. And now we have coconut milk, almond milk, hemp milk, cashew milk, all these milk substitutes. They have cheeses now. And I'll grant you they may not be as delicious as an imported Italian provolone, being Italian, but it's well worth it. And so everything in the world there's a substitute now for everything, which is kind of cool. So you don't have to dig into these deadly sins, what I call 7 deadly sins, because there are substitutes for it. And here's the neat part. It's cheaper than anything you're doing right now. So some people do this because it's the healthiest way to live. Some people do it because it's the cheapest way to live. Either way, you're going to get all the benefits. So you'll save so much money, and you'll probably live longer, and your kids will probably be healthier, and you'll be happier, and your love life improves, and you go to the bathroom better, and you sleep better, and you'll look younger. Why wouldn't you do that? have to laugh when I watch TV and on certain shows, every second commercial is for some skin cream, some moisturizer. It's going to plump up your eyes. It's going to get out your wrinkles. Well, what if you just didn't cause all those problems? Now, we're all going to get old. We're all going to wrinkle. I understand that. I'm okay with that. But you can stop a lot of it. And once again, you'll save money, if nothing else, on skin creams. So, all right, so we're talking about ADD and ADHD. I've got a lot to cover here. Gosh, time flies so quickly on these shows. American Pediatric Association stated a few years ago that they don't recommend giving antibiotics for ear infections unless absolutely necessary. Because they did some studies, and what they found was that the child who got antibiotics and the child who didn't get antibiotics recovered in the same amount of time. Okay, so why is there an issue with antibiotics? Well, antibiotics kill bacteria, good bacteria and bad bacteria. So it's not just the bad bacteria they're killing the good stuff. And your immune system, 70% of your immune system is in your digestive system in the form of what? Bacteria, good bacteria. So antibiotics are not site-specific. What that means is they don't just go to one place. They go through the whole body. They're systemic. So if there's an infection, what I recommend, again, I'm not a medical doctor, I'm not telling you to take drugs or not take drugs, is something called ear oil. And this is something I've seen work many, many times. Again, always check with your pediatrician. I'm not telling you to go against what your doctor's saying. Ear oil, you can make it at home, you can buy it, it's a lot easier. It's usually an oil, like an olive oil, garlic sometimes, golden seal, oil of oregano, that might be a little sharp sometimes. But you can take it and just put it directly in the ear. And so now you're treating the infection here, not wiping out the whole body systemically. So it's very effective. Chiropractic care does wonders in most cases with ear infections. Because what happens is when the baby's born, they got a little skull, a little neck. The atlas, the top bone in the neck, is real close to something called the eustachian tube. And a eustachian tube is a tube that runs from your ear down into your throat. And with babies, many times you get the ear infection in the eustachian tube. So we can put, like I said, ear oil there. And if the atlas moves out of place, it can pinch the nerve and irritate the eustachian tube. So by putting the bones in the neck back in place, we can physically move the bone away from the eustachian tube and open up the nerve and blood supply. And in many cases, children heal very quickly. It's kind of cool. So the ear infection, in many cases, is a mechanical problem. It's a bone out of place, not necessarily just a chemical problem. And then, of course, you got to stop giving the kids sugar, because sugar blows out your immune system. In my book, Prescription for Extreme Health, we have a whole chapter on immunity and sugar, and how 1 can of sugar can weaken your immune system short term about 14 times, make it 14 times weaker, just having 1 can of soda. And I think next week we're actually going to do a show just on soda, as a matter of fact. So that's one of the little things about sugar, and soda has so much sugar in it. But all sugar, breads, cookies, cakes, donuts, pastas, even if you have just a piece of white bread or regular bread, the flour is essentially eating sugar, and it weakens the immune system. So we're trying to avoid putting the antibiotics in the body so we don't affect the bacteria in the colon and weaken the immune system, which, as we started the show with, many children with ADD and ADHD have digestive problems. So I want you to consider this. We want to take care of the digestive system. Vitamin D. I cannot stress enough the importance of vitamin D. There are studies now showing that it can help in cancer patients. It can help with immune systems. I saw an article the other day that it can be as effective as the flu vaccine. Now, again, I'm not saying take the flu vaccine or not take the flu vaccine, but the flu vaccine can be like 25 to 30% effective. 5,000 international units of vitamin D a day given to an adult is about 25 to 30% effective. And if you do get sick, it can reduce the symptoms by about 50%. Wow, that's pretty cool. So vitamin D is really important to keep a baby healthy, so hopefully we can avoid the antibiotics. I don't know any doctor, regardless of what their profession is, that wants to give you more drugs. They all say the same thing. We got to be careful with this. It's dangerous. We don't want to overdo it. And I agree with that. If I need medication, I'm going to take it, no question. But what can I do to not take the medication is always my approach. So vitamin D is so vital, and the research is just pouring out, showing how important the vitamin D is. And we have a supplement on my website, drjoe.com. It's called Dr. Joe's Vitamin D, and it has K2 in it, which helps build your bone mass. But 5 drops of that a day for an adult is going to give you 5,000 international units of vitamin D. Make sure if you're taking vitamin D, if you're not taking mine, make sure it's quality, of course, but we know mine are quality. Make sure that you're taking vitamin D3 and not vitamin D2. And the reason is vitamin D3 is non-synthetic. Vitamin D2 is synthetic. It has to be converted into vitamin D3. So it's just a little trick there. You got to be careful. Another thing I want you to consider to keep the immune system strong for the baby so we don't have to give them antibiotics, which can affect their digestive system, which could be linked to emotions and brain function. Well, it is, but we're talking about ADD and ADHD specifically today. Nutritional yeast. If you don't know what nutritional yeast is, it's a powder. It has something called beta-glucan. And beta-glucan has been shown to help the immune system tremendously, very similar to the vitamin D. So if you start stacking vitamin D with beta-glucan with no sugar, we also have something called Dr. Joe's Wellness Booster, which is echinacea, pau d'arco, olive leaf extract. That helps stimulate the immune system as well. And then, of course, the flagship supplements are Dr. Joe's Super Greens and Dr. Joe's Essential Source. These two are just off the chart, amazing. I don't know how people live without it. A couple of weeks ago, we ran out of the Essential Source for about 2 weeks. You would have thought riots were going to break out in my office. Where's the Essential Source? I need my Essential Source. People were getting like angry. And it wasn't anybody's fault. It was a shipping issue. But as soon as we got it in, bam, place like cleaned out our shelves. So Super Greens and Essential Source, the minimum amount of nutrients you should take every day. They're 2 powders. They taste great. I mix them with coconut milk, almond milk, cold water. You can mix it in a smoothie if you want to. Very easy to take, relatively inexpensive for what you're getting. It's just incredible. Then I take vitamin D, vitamin D3, and then I take nutritional yeast every day as well, and then the Wellness Booster. And all of those are on the website, drjoe.com. Also available on Amazon too. But if you go to the website, we have a big description of everything there. So if we can keep you and any other child off the medications, that's our goal. We talked about chiropractic care earlier. And let me talk a little bit about that if you don't know what that is. Chiropractic care works on getting to the cause of the healthcare problems. In many cases, it's a pinched nerve. So if you have neck pain, back pain, shoulder pain, numbness, tingling, if you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. This week I had a patient come in. She's been under treatment for 2 years. She said, Dr. Joe, I listened to your shows and I need you to check me out. Checked her out, found her problem within 10 minutes. We checked with the lawyers. There's a lawsuit going on. They said, absolutely, positively, Dr. Joe, treat her. And I said, why didn't you just come here sooner? Maybe, and I don't know this, I'm not against other therapies, believe me, but maybe we could have solved a whole lot of problem, saved a whole lot of money, and saved a lot of your suffering and damage to the body. And she says, I just found you on radio. I just watched you on TV. I didn't know you were even here. So if you want to make an appointment to come see us for any neck pain, back pain, digestive issues, nutrition issues, go to my website, drjoe.com. And we have in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We would love to be your doctors. We want the opportunity to check you out. If you don't have a problem we can help, or it's something we don't think you need treatment for, we're going to tell you that. If it's something I think we can help, we'll tell you that too, and then you can decide what to do. But the website is there 24 hours a day, drjoe.com. You can make an appointment right online. If you have questions about insurance or locations, times, it's all on the website. Again, you can always give us a call. The number's on the website, and we're more than happy to answer any questions we can for you. But make the right decision. Biggest complaint I get is, why didn't I do this sooner? Why did I suffer so long? And it's very, very affordable. Believe me, it's crazy affordable how affordable it is for what you're getting to get well and to get results, which is worth everything. So we're talking about ADD and ADHD. Parents, little trick here, try to say nice things to your kids. Because once again, if a child has an emotional issue or a brain dysfunction, it's not like the child's doing it on purpose. Many times the brain is not working. You need to stimulate the dopamine receptor sites in the brain. It's called the nucleus accumbens. And when the nucleus accumbens releases dopamine, you feel good about yourself. It's the pleasure neurotransmitter. And one way you can give a pleasure is by compliments. So here's a little rule, little parenting. Again, he's your kid, do as you seem fit. 2 nice things for every 1 negative thing that you say. And it's pretty amazing how kids respond. Kids don't realize you're doing it. You're messing with their heads, but you really are literally messing with their heads. Now remember, if the child is hyper, the child's a problem, you want to work with this child to do everything you can to get them well, because, as the saying goes, they're the ones who are going to pick your retirement home, and you don't want them putting you in a nursing home and not taking care of you. So you've got to be nice to them now, because they'll remember these things. So a couple other things we want to talk about with children and helping their body work normally. Bedwetting. If they wet the bed after 5 years of old, it could be a sign of low magnesium. What happens is magnesium helps the bladder muscles stretch so that it can hold all the urine that it has to. And so if you're going to do magnesium, make sure we're not doing magnesium oxide. Okay, it's not as effective as the other forms of magnesium. So look at the supplements. My grandfather, in my book, A Prescription for Extreme Health, I quote my grandfather. And he said, always buy the best. It's always cheaper. And he was an immigrant from Germany. came to America during World War II, didn't speak English, as a German, coming to New York. Brave move. But he always said, always buy the best, it's always cheaper, and it's so true. And when it comes to supplements, boy, is that ever true, because the supplements are going to determine how your body functions. So that's why if you're going to do magnesium, try not to do magnesium oxide. That's why I recommend Dr. Joe's Super Greens and Dr. Joe's Essential Source. It's a complete multivitamin. It's prebiotics, probiotics, which helps the colon, good bacteria. It gives you fruits and vegetables, digestive enzymes. So I couldn't go a day without my Super Greens and Essential Source. And the nice part is it travels well, too. It goes through the airport. It's perfect. I went through the airport the other day, and I had a bunch of books with me, and my supplements. They never looked at the supplements. They took each book and opened up each one individually. So I was flying. I was going to be a guest on a Dr. Oz show, and they had the supplements there, and the books, and they opened every one, and of course they let me through. Supplements were never checked, so they travel well too. Dry skin and eczema. If you have that, it's usually a sign of essential fatty acid issues. You want to make sure you're getting enough good fats. Now, good fats from a plant-based source might be flax seeds, chia seeds. This is omega-3 fatty acids. A supplement you might want to consider, and this is one of the supplements I do recommend you take, is an omega-3 fatty acid supplement. Now, there's 3 types. There's fish oil, which I don't recommend. It can have mercury and lead in it and heavy metals. There's krill oil, which is a better choice. It's in what's called the phospholipid form, so it's easier to digest. But my favorite is the algae oil, because fish and krill don't produce omega-3 fatty acids. They get it from eating krill. Fish eat krill, krill eat algae. So the algae is the purest form of omega-3 fatty acids. So you want to do about 1 gram of omega-3 fatty acids a day. And whenever I see a skin condition, the first thing I think of is a liver malfunction. So what I tell my patients is, let's get you off dairy, let's get you off wheat. Chiropractically, just check your nervous system, because pinched nerves can affect the function of the organs. Whether they hurt or not, you can still have pinched nerves. Then we put them on a nutrition protocol, and almost every patient who follows our advice comes back and says, wow, this is just amazing. I wish the whole world knew about this. Well, now you know. It's pretty cool. If you have bad recall, you're having trouble remembering things, it could be a B6 problem. If you're ticklish, if you're sensitive, you can't focus on things and everything annoys you, that could be a problem with calcium or magnesium as well. So many times with ADD and ADHD patients, every little thing bothers them. What was that noise? Who was that? Where's that light over there? You know, I mean, if you saw that movie with the squirrel, right? The dog. Squirrel, squirrel. And he kept looking at this every time a squirrel would come by, he couldn't focus. Well, we joke about that, but that's really what's going on in someone who has ADD and ADHD's brain. So you got to look at magnesium, calcium, essential fatty acids, and again, all of that's in this Super Greens and Essential Source, which is so great. We got to talk about the digestive system when it comes to ADD and ADHD, because in my experience, 34 years of seeing, well, more than 34 years, I did my internship as well. My experience shows that there's always a digestive component that's never been addressed. And every ADD and ADHD patient I've seen, they have all these qualities. They have these issues. They're ticklish. They're protecting their digestive system. When you go to poke in here, you drop them right to their knees. Many times I try to work on a patient's digestive system, and they're so ticklish I can't even touch them. Anybody know somebody like that? So what I do is I put their hand on themselves, because this is the cool part, you can't tickle yourself, and then I'll put my hand over theirs, and I'll actually do the manipulation or the adjustment through their hand. And that seems to solve the problem. And it's amazing when parents bring their kids in with ADD and ADHD, and I can't even touch them, they're so ticklish, and when I do these techniques on them, and then I'll go to the kid and I'll start poking on their stomach, and they just sit there. And the mother's like, what did you just do? I've never been able to touch my child. He's been screaming forever as he's so ticklish. Once you fix the cause, the symptoms start to go away, which is kind of cool. So I won't have time in this segment to talk about this. When I come back, though, we're going to go really in depth on how the digestive system works, how the stomach breaks proteins into amino acids, and amino acids become the neurotransmitters, and the neurotransmitters in the brain, the chemicals in the brain, when they malfunction is when we have, today we're talking about ADD and ADHD, but all emotional issues. Anxiety, depression, bipolar, even suicidal patients. We work with these patients, along with their counseling, along with their medical professionals, to try to get their brain stabilized. And in most cases, we get great results. So if you'd like to come see us, we have offices in the Atlanta area, Marietta, Duluth, and Stockbridge. We would love to be your doctors. Neck pain, back pain, shoulder pain, headaches, numbness, tingling, acid reflux, heartburn. Many times we need to adjust the spine, adjust the stomach. We can adjust the shoulder, the foot, the knee, the ankle. So when you think chiropractic, don't just think spine. There's 206 bones in the body. We adjust wrists and elbows and shoulders and feet and knees all day, every day. We can even adjust the skull. So if you're sick and tired of being sick and tired, I bet you are, why don't you go to my website, drjoe.com, and set up a time to come see us. We accept most insurances. If you have questions, you can always call the office. The number's on the website. You can book the appointment right online. We're more than happy to do that for you. We have well over 1,000 hours of podcasts on my website, drjoe.com. And if you have a podcast service, it's called For the Health of It, which is the title of my first book, Eating Right for the Health of It. And For the Health of It is a great way you can binge listen, along my website, to binge listen to shows, because we want to get you well and keep you well. Again, I'm Dr. Joe Esposito, website, drjoe.com. Don't go anywhere. I'll be right back. Hey folks, Dr. Joe Esposito here. So glad we're spending time together. Remember Carol Burnett? I'm so glad we had this. And many may be not old enough to remember the Carol Burnett show. What a great show, though. Anyway, I'm Dr. Joe Esposito. We're talking today about ADD and ADHD and getting the brain to reboot itself, for lack of a better word, getting the brain working better. And it's really an important issue because it's not just if you've been diagnosed with ADD and ADHD, it's getting the brain to work more efficiently, because your brain controls everything. Your brain sends messages down the spine, out the nerves, to every cell in the body. And so if the brain is able to tell the heart, the lungs, the liver, the spleen, the kidneys, the gallbladder, the ovaries to work more efficiently and work properly, the chances are it's going to improve your health dramatically. So many patients, thousands and tens of thousands of patients that we've seen in our offices and millions all around the world in chiropractic offices, we realize that the nervous system controls everything. And if there's any interference from messages from the brain to the body, you might have pain. Well, that's obvious. However, 90% of your nerves don't feel pain. You don't feel your blood pressure. It's controlled by nerves. You don't feel your kidneys, controlled by nerves. You don't feel your hair grow, controlled by nerves. So my concern when a patient comes in our offices is not only the nerves that feel pain, it's the nerves that don't feel pain. And with ADD and ADHD, any emotional issue, we got to look at the brain not functioning properly. So it could be a pinched nerve cutting off the nerve and blood supply to the brain. It could be a digestive issue, which is huge, which we're going to go into in depth right now. It could be nutritional deficiency. That's why I recommend supplements for a lot of my patients, and a good diet. Supplements are just that. They supplement your diet. They're not instead of a good diet, they're in addition to a good diet. And here's the thing with eating right. People get a little wacky when I talk about eating right, and they say, I could never do that. Okay, try it. Give me 2 weeks. If I'm wrong, I'm wrong. I lied to you. I always joke when I have a woman in the office, I'm not the first guy to ever lie to you. They go, hey, you're right, ha ha. But if I'm right, which I am, then I want you to do this forever. And most people are willing to give me 2 weeks. And the ones that do it, which is a major majority of you, you say, wow, this is incredible. I have so much energy and I'm sleeping better and my skin cleared up. I'm going to the bathroom again. My breath doesn't stink. And oh my gosh, this is great. I can do this. And you don't have to do everything. Do little steps at a time. At least take Super Greens and Essential Source. Those are 2 supplements that are on my website, drjoe.com. And that's the minimum amount of nutrients you should take every day. And then you start adding something raw at every meal. Broccoli, cucumbers, tomatoes, avocado, salad. And then from there, then you start cutting back on the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. And then maybe we give you more supplements. We get you on some more raw foods, or we get you on some more vegan or plant-based foods. And you go, this is really easy. And it's really cheap. And then, of course, we have to incorporate chiropractic in that, because the nervous system controls everything. You can put really good gas in the car, but you got to tune up the wires too. So there really is a healthcare plan. That's what we offer, a healthcare plan. We don't offer health insurance, which is what a lot of you have. We offer a plan. How many of you have a healthcare plan? What you're going to do day by day, week to week, to get yourself well and keep yourself well. Most people don't have a healthcare plan. They have an insurance plan, but not a healthcare plan. So I got to discuss digestion and brain function, because I can give you a 2-hour workshop easily on this and still have more to cover. But what happens is you swallow food, it goes down your gut, and there's a little hole in your diaphragm, your sheet of muscle called the diaphragm. There's a hole in the diaphragm, the food drops through the hole, you close, that hole closes, you digest food, and you pass it on to your small intestine. If you have acid reflux, heartburn, burping, gas, bloating, chronic cough, chronic sinus condition, chances are the stomach is actually pushed up through that hole, and you're having acid come up into your throat. Acid reflux. So we can take all the antacids we want, and we can take all the proton pump inhibitors we want. It's not going to treat the cause. It's only going to treat the symptoms. And again, if you have to take them, take them. But what we do in our office is we always check the stomach and the digestive system, and many times we need to adjust or pull the stomach down away from the diaphragm. And when we pull the stomach down away from the diaphragm, the stomach relaxes. That little hole called the lower esophageal sphincter closes, so acid and food can't come back up again. And now your stomach does its job. And your stomach's job is to take proteins and break them into something called amino acids. Now, the amino acid tryptophan combines with vitamin B6. Remember we talked about vitamin B complex earlier in the show and how important that is for brain function. Tryptophan combines with B6 and creates a chemical called 5-HTP. 5-HTP goes into the brain and creates something called serotonin. Now here's the thing with serotonin. 95% of the serotonin in your body is not used in your brain. It's produced in your digestive system. And it makes the nerves in the digestive system work. It makes your digestive system work. So if you have a shortage of serotonin, because you have a shortage of raw materials, who's going to win? Digestive system gets 95%, brain gets 5%. Brain's probably going to lose out a little bit. Serotonin is your happy neurotransmitter. It helps you be happy, and here's the thing, it helps you focus. What are we talking about today? ADD and ADHD. So if serotonin levels are normal, you're able to focus more efficiently. In fact, what are the medications we give for people with this? Specific serotonin reuptake inhibitors. So what that means is you want to utilize the serotonin that you have more efficiently. What if we just made more serotonin? And then there's plenty of serotonin to go around. Your stomach gets some, your brain gets some, everybody gets a fair share. It's pretty cool. So if we can get a more serotonin production, that's going to be great for your digestive system and your brain. Serotonin becomes melatonin, which helps you what? Helps you sleep. So many people with ADD and ADHD have trouble sleeping, or they sleep at weird hours, or they sleep excessively and then they can't sleep at all. Got to look at the digestive system. So in order to get the brain functioning, you have to make sure the stomach is breaking proteins into amino acids, and amino acids have the B vitamins to produce the neurotransmitters. That's why a supplement we have on my website, drjoe.com, is Dr. Joe's B complex. It's one of the supplements I take every day. Couldn't imagine not taking a B complex. Want to make sure my brain is working. And the website is drjoe.com in case you're just tuning in. So what else happens in the stomach? Well, tyrosine becomes dopamine. Tyrosine is the neurotransmitter that becomes dopamine, and dopamine, or tyrosine is the amino acid that becomes dopamine, and dopamine gives you pleasure. So we have folks with emotional disorders, many times there's no pleasure in their lives. Things that everybody else is having a great time with, cuddling up on the couch. When you cuddle, by the way, when you hug somebody, you can release dopamine. So if you have a child, or anyone with an emotional disorder, one of the greatest things you can do with them is just have some cuddle time with them. Give them a hug. Sit with your arm around them. Touch their arm while they're talking, and that can start releasing the dopamine. So dopamine is the pleasure neurotransmitter. You can't produce dopamine unless your digestive system is breaking proteins into amino acids. And if you're having things like acid reflux and heartburn and burping and gas and bloating, you're probably not digesting your proteins properly. You with me? Glutamine becomes GABA. GABA suppresses pain. Now, as a chiropractor and a pain management specialist, patients come to me all day, every day, my team of doctors and I, and talk about pain. So what can we do about that? Well, what if we have a better production of glutamine to produce GABA, and GABA helps suppress the pain? Because where somebody who has normal brain function, normal GABA production, may not have the sensitivity to pain that somebody that doesn't have a normally functioning brain. Got it? So I know it's a little complicated. The good news is, if I got you lost, this show is on my website, drjoe.com. This and 1,000 other shows, audio and videos. You can download them too. We have SoundCloud on my website. And if you have a podcast service, this podcast is called For the Health of It. So you can tune in there and listen as well. And you may have to listen to this one a few times. I even have neurologists, neurosurgeons, medical professionals, chiropractors say, Doc, I got to listen to your shows 5, 6, 7 times. You just like blow my mind. Good. It's a lot of good information. I want you to absorb something each time you listen. My trick is this, and I teach a lot of students and interns that follow me around. I always teach them, you got to hear something 11 times. So if you like what you're hearing in any specific show or all the shows, listen to it over and over and over again. Eventually, it'll sink into that brain. It'll get stuck in there. So we got to get the digestive system working. So the best thing I find is we can take the stomach, if it's not out of place, and massage it and pull it down away from its the position up against the diaphragm so it's relaxed, so it's digesting the proteins into amino acids. Then what happens is, if the food is digested properly in the stomach, when it passes on to the small intestine, it's properly digested. If it's not properly digested, these big chunks of undigested food can actually tear holes in your colon. And these holes are something called leaky gut syndrome. Now, 35 years ago, I was teaching about leaky gut syndrome, and I was poo-pooed. What is that leaky gut syndrome? That's stupid. Your colon can't have holes in it. That's ridiculous. Now, it's mainstream. So we put that in the very, very long column that we call Dr. Joe was right. So the things we taught 35, 20, 15, 10, 2 years ago, last week, many of those, in fact, most of them have become mainstream. So by listening to this show, you are so far ahead of the curve when it comes to healthcare. You're much cooler than all your friends. You're one of the cool kids now. So if the stomach is breaking foods properly down, it goes into the small intestine. The small intestine does its job, and you don't get these little tears in the gut called leaky gut. When you get a tear, chunks of undigested protein, food, fecal matter, bacteria can get into the blood system. And the blood system, when it gets into the blood system, the immune system has to attack it. And when the immune system attacks it, it creates an inflammatory reaction, a systemic inflammatory reaction. Systemic means the whole system. So the whole system now becomes inflamed, including the brain. And with ADD and ADHD, the brain isn't functioning normally. Any emotional disorder, we're just kind of focusing on those two today. So if the brain isn't functioning normally, many times there's an inflammatory component and there's a digestive component. Digestive meaning nutritionally as well as physically not working properly. So when we start fixing the digestive system, actually tuning it up, pulling the stomach away from the diaphragm, getting there, massaging any spasms, chiropractically checking nerves from the spine that control the digestive system. Then getting on good foods, super greens, essential source, B complex, vitamin D, keeping the immune system strong, eating something raw at every meal. Try to eat a more plant-based diet. Plant proteins, by the way, are easier to break down than animal proteins. So if you're having trouble digesting your food, maybe switch to more plants. Because the plants are easy to break down, so you can get the amino acids to produce the neurotransmitters, and it's so much easier and quicker and cheaper and less energy. Number one consumer of energy we have as humans is what? Romance. The number two consumer of energy is digestion. So I'm assuming most of you aren't having romance all day, every day, but all of you, I'm assuming, are digesting all day, every day. So if we can take the stress off our digestive system, the bacteria can start to recolonate if they've been damaged. They can start getting healthy. You're putting good nutrients into the body. You're checking the nervous system, checking the function of the digestive system. My gosh. Now you have your what? Your healthcare plan. And I tell you, I've had patients with ADD and ADHD, usually children, parents will bring their children in, and they'll come back in after several visits and say, so I had a meeting with the teacher. I said, oh, here it comes, go ahead. And some people play with me. They go, I had a meeting with the teacher, and they roll their eyes, and I'm like, oh my gosh, what happened? They said, you finally put him on the medication, didn't you? Or her. It's usually boys. And the parent says, no, we didn't. They said, well, he's sitting in class, and he's getting better grades, and he's finishing his homework, he's not disrupting anymore. What did you do? Well, Dr. Joe had the protocol. We got him on the protocol. We got him on the right nutrients, got him on supplements, we got him adjusted. Whatever you're doing, keep doing it. And I love this one. When teachers say, you know, I hear a lot about Dr. Joe's protocol with children like this. Parents come in all the time talking about it. And so it's kind of neat that the parent, and this is the thing that gets me, so why aren't you sending every child with ADD and ADHD to our offices? I don't know that answer. Hopefully that'll be the norm one day. So digestion is going to be a key when it comes to getting the brain working properly. There's something called the Feingold Diet for ADD. Dr. Feingold, and I like his work, I'm not saying his work is wrong, I don't think he went deep enough though. So Dr. Feingold found that people were sensitive to something called salicylates. Salicylates are found in aspirin. So what he found that many foods, called citrus, many berries, other fruits, certain vegetables, have salicylates in them. So the Feingold diet, he took people with emotional issues off these salicylate high foods, and in many cases he got good results. So eliminating salicylates worked for some people. So I don't have a problem with that. So again, it's not my research, it's Dr. Feingold's research, but that's another thing you could add into the repertoire. But where I think Dr. Feingold fell short was that he didn't talk about fixing the digestive system, physically fixing the digestive system that we talk about so often. And he didn't talk about chiropractic care and opening up the nerve supply going to the organs. So again, you're treating a symptom, getting people off salicylates, getting off sugar, getting off alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. That's all well and good. Let's go to the next step. Let's put a ton of good nutrients into the body. Super greens, essential source, B complex, vitamin D minimum. All those are on my website, drjoe.com. For adults or even children, if they have bags under the eyes, many times that's an adrenal gland problem. The adrenal glands produce anti-inflammatories called prostaglandins. And if you're putting such a strain on the adrenals to pump out a lot of prostaglandins, it can create an inflammatory reaction. You can't keep up with the stress. And you might get tired because the adrenal glands produce adrenaline, and they also produce your sex hormones. They produce something called pregnenolone, which becomes DHEA, which becomes your sex hormones. If you're under stress, they don't produce your sex hormones. They produce an inflammatory component called cortisol, inflammatory hormone. And so now we have more inflammation. So a lot of times I'll put people on adrenal support as well, and that's on the website, drjoe.com. You got to take these people off any stimulants, because again, it's stressing the adrenal glands. What would that be? Coffee, chocolate, even teas, any type of caffeine, sodas, of course, sodas, gosh. So these are protocols that you can do. And the cool part is this, it's good for everything. It's not just good for ADD and ADHD, it's good for your whole overall health. It reduces your risk of infection, it reduces your risk of heart disease, diabetes, cancer. It's cheaper, you live longer, you have more energy, you lose weight. Why wouldn't you do it? I don't know, it's a question. All right, this is interesting. Nutrition-based intervention for ADD and ADHD disorders. Purpose of this study, determine if a plant-based intervention would result in behavioral improvement in children and adults with ADD and ADHD, hyperactivity disorders. 100% who followed recommendations in this research, and this is by Dr. Robert Thiel, PhD, 100% of people followed the recommendations reported behavior improvement within 40 days. So it's not just me doing this research. You've got other doctors out there, PhDs, medical physicians, neurologists doing the research. We all come up with the same results, which is really cool. So we got to get the nervous system working. So from a chiropractic standpoint, we always check to see if you have pinched nerves, because the nervous system controls everything. So from a chiropractic standpoint, if you have neck pain, back pain, shoulder pain, numbness, tingling, headaches, if you've ever been in a car accident, if the car was damaged, you were damaged 100% of the time. Whether the accident was last night, last week, 10 years ago, 20 years ago, 50 years ago. Come see us. We'll check it out. If there's a problem, we'll tell you. If there's not a problem, we'll tell you that too. So and the sooner you get to us, by the way, the better. I mean, sometimes it's way too long that you can't have a case anymore. But the insurance companies are mean. They look to say, oh, you only waited 3 weeks, well, 5 weeks, whatever it is, 10 weeks. We're not going to pay your claim because we don't know you're really hurt. One of my patients got in a little fender bender. She hit somebody, snapped her neck. I said, she's no big deal. I said, Deb, trust me, it's going to hurt. She goes, no, it's fine. Just give me an adjustment. So I did an exam. I treated her properly. 2 days later, she came back and she couldn't move. She goes, oh my God, you were right. Oh my God, it hurts so bad. So if the car was damaged, you were damaged. You know how much damage was to her car? A scratch on her paint. It's all the damage was in her car. And she damaged her neck because her head snapped when she got hit. So if you have a problem, stop suffering. The longer you wait, the harder it is to fix. So make an appointment right now for you, your friends, your family, and your children. Go to my website, drjoe.com. You can make an appointment right online. In Atlanta, we have offices in Marietta, Duluth, and Stockbridge. Now, if you're outside the Atlanta area, you could always come see us. We have people fly in from all over the world, but we can always do a video consult on computer. We can do a Skype or a phone consultation if we need to as well. All the information you need, drjoe.com to make an appointment, and all the supplements we talked about, the super greens, the essential source, the B complex, the adrenal support, the vitamin D, all of those are on the website. You can order them right there, drjoe.com. And if you come by our offices and pick them up, by the way, guess what? No shipping. Save you some money. So I strongly advise that you get on a good diet and take the supplements, and that'll help everything, including the ADHD. 51.5% of participants in this study with ADD and HD were calcium deficient. Calcium can function as a natural tranquilizer, calm the nerves, and relieve cramps, because a lot of folks with ADD and ADHD have a lot of muscle spasms. Non-bovine sources were the best, which means not from dairy products, because we know dairy is the #1 food allergen. So green leafy vegetables, bok choy, cabbage, turnip greens, spinach, broccoli, Dr. Joe's Super Greens, Dr. Joe's Essential Source, excellent sources of high-quality calcium. Dietary habits and food processing techniques. Every American, this one doctor makes a prediction, I'm not sure I agree with this, this one doctor is predicting every American will suffer some type of thyroid malfunction if you eat what we call the SAD diet, the Standard American Diet, SAD. And I don't know if everybody's going to, I hate to say everybody in anything, there's never an always or a never, but a lot of people come in my office with thyroid malfunction. And 35 years ago, I didn't see it so much. Now I see it all the time. Thyroid. So we have thyroid supplements as well that we can get a patient on as well. But we want to make sure we have it. And the kicker is this, that a lot of times people have the symptoms of thyroid, they take a thyroid test, it doesn't show up yet. It's not, the tests I guess we have today just aren't as sensitive as they need to be. So many times if I start seeing the symptoms of it, we got to get them off the things that are irritating their thyroid. The study focused on 12 different food groups that were involved, and none of the items appear to be universally affect each person. So everybody's a little different is what it boils down to. Some people are going to respond to salicylates. Some people are going to respond to getting chiropractic care, which most do, as a matter of fact, getting the digestive system working, digestive enzymes. But the overall protocol would be a normally functioning nervous system from a chiropractic standpoint, get the nervous system working. Normally functioning digestive system, make sure we can pull the stomach down away from the diaphragm, make sure you have enough digestive enzymes. Eat something raw at every meal, because raw food has enzymes in it. And then make sure you're taking the proper nutrition. At least Super Green's an essential source, but we try to put together a protocol for each one of our patients, but that's a good starting point. And a lot of people come in our office, start with those and go, oh my gosh, this is amazing, what else can I do? And here's the thing. When you start making dietary changes, it happens pretty quickly. But you saw in this one study we just talked about with ADD and ADHD and a plant-based intervention, it took up to 40 days. So don't take a supplement one day and go, I don't feel anything. It's not like an aspirin. If I have a headache, I take an aspirin, it helps my pain in a half hour, 45 minutes. You got to rebuild and restock your body. Patient came in the other day about nitric oxide. Nitric oxide is one of the supplements on the website, and it opens up your blood vessels, increases circulation to your brain, to your reproductive organs. Some people have circulatory issues and reproductive organs, keeping it clean. It's a family show. And she said, Doc, I started taking it for a couple of days. I didn't see any change. I said, you got to build up your stores of nitric oxide in your body. And she was probably a 65-year-old woman. I said, you've been depleting your nitric oxide stores forever. Let's give it a few more weeks. She said, should I double up? I said, no, don't double up. I'd love for her to double up. She buys more product, but that's not what she needed. I said, let's not double up yet. Let's just take it, recommended dosage. Let's let that build up for a couple of weeks. And then if we still don't see a change, then we can always go ahead and double up or increase the dosage. And she said, thank you. There's a patient in the reception area, and they came up to me and says, Doc, that's what I really like about you. I listen to your shows all the time. You just give it to them straight. You could have told her to take twice as much, but you didn't. And I said, no, I want to get you well and keep you well. When I have a patient relationship, my goal is to keep that relationship forever. And I tell all my patients, if there's ever a problem or something you're not happy with, tell us so we can fix it. I can't read your mind. I'm not psychic. And I always say, we'll never do anything malicious. Might be stupid, but it's never malicious. So just tell us. And if there's an issue, let us fix it. Because I want to have a good relationship with our parents. All my doctors are amazing, and they have very good relationships with the patients. And the patients are pretty happy, which is really kind of cool. And in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. So we'd love to work with you there. Don't have enough time. Probably going to have to do a whole other show on this one. I want to cover autism, which is different than ADD and ADHD. But when I was a kid, autism was about 1 in 10,000. We didn't have numbers even. Now we're looking at numbers 1 in 50. I think New Jersey is the highest rate of autism, 1 in 41, if I remember the last study I read. So New Jersey, I'm from New Jersey. Way to go, guys. We're number 1 in autism. Woohoo! But I grew up in a place called Carlstead, East Rutherford area, and it was called Cancer Alley. And there was chemical factories literally like next to houses in my neighborhood. You'd have a house, and Michael Zippor lived in one, and Bob Johnson lived in another one, and there's a chemical factory, Sun Chemical. And then we had another house. We never thought twice about it. It always stunk. We always joked about how bad it stunk in New Jersey. But these chemicals were being dumped into our environment, literally people living next to it. They didn't have zoning back then, really. And a lot of those plants, most of them have been closed down now because they realize how toxic it is. And some of them you can't even build on for like, I don't know how long, before the soil can start breaking down these toxins. So environmental issues can be a problem. And with autism, many times we find high exposure to heavy metals like mercury or aluminum. And that can get in the brain as well. So we got to be really careful with that. Again, I won't have time to go into that today. I've only got about another 2 minutes here. But a lot of indications show that exposure to multiple sources, including what the mother's exposed to in utero. We did a show last week, I think it was, on how chemicals affect your hormones. And the studies are now showing what the mother is exposed to affects the child. So we opened the show today with talking about what parents or potential parents need to do to get well and stay well. So if you missed it, you're just tuning in now, you missed an amazing show, go to my website, drjoe.com. We have well over 1,000 hours of podcast, audio and video. Some people are auditory learners, some people are visual learners. If you have a podcast service, it's called For the Health of It, so you can catch it there and binge listen. I love it when people come in and say, Doc, I listened to 20 of your shows in the past couple of weeks. I listened to 50 shows. Every time I travel, I download your shows. I'm on an airplane. I listen to Dr. Joe shows constantly. Because my goal is to naturally get you well and keep you well. And a lot of that information that you need is on the website, drjoe.com. We have a blog there. do me a favor, follow me on Facebook, follow me on Instagram. Sometimes we live stream our shows, which is fun. Send us your email address, because we'll put you on a special. That's our the cool kids list. And we send out specials sometimes on supplements or something we may be doing, maybe a private breakout lecture just for my website, people that have their email address. So you can do that on the website, drjoe.com, if you want to make an appointment to come see us. I think you should, by the way. The website is drjoe.com. We have offices in Marietta, Duluth, and Stockbridge in the Atlanta area. If you're outside the Atlanta area, that's okay. We can do phone consultations or Skype consultations. We want to get you well and keep you well. The supplements that we talk about, the minimum supplements you should be taking every day, Super Green's an essential source. I would recommend absolutely positively vitamin D, especially if it's not the summer months. B-complex is important for nerve function. All those supplements and a lot more are on the website, drjoe.com. So folks, I'm Dr. Joe Esposito. Once again, what's the website? drjoe.com. Thanks for tuning in. Tell your friends about the show. We'll catch you next time.